Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss what Angelman syndrome is, its causes, symptoms, diagnosis, treatment options, and epilepsy and Angelman syndrome. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified of future videos. Please click on our donate link in the description section below and donate today. Your donation helps us to make a difference for those battling epilepsy. We appreciate your support. Angelman syndrome is a genetic condition characterized by developmental delays, underdeveloped speech, ataxia, and seizures. It affects around 500,000 people globally and emerges as a result of UBE3A dysfunction. The condition was first described by Dr. Harry Angelman in 1965. Signs of developmental delays can be observed by 6 to 12 months of age, while other symptoms, including poor motor skills and gastrointestinal issues, tend to appear in early childhood. Symptoms vary. However, people tend to present some rather than all characteristics associated with the condition. Common symptoms of Angelman syndrome include stiff, jerky body movements, little or no functional speech, feeding problems, especially in infancy, delays in motor development, seizures, developmental delays including no crawling or babbling, intellectual disability, difficulty walking, moving, or balancing. In addition, children with the disorder may display the following: frequent, unprovoked outbursts of laughter, hand flapping motions and walking with uplifted arms, restlessness, hyperactivity, trouble sleeping, a particular fascination with water, an excitable, friendly nature. These symptoms tend to fade with age as children develop better sleep patterns and become less hyperactive. In some cases, people with Angelman syndrome may possess distinctive facial features, including cross eyes, pallid complexion, wide mouth, scoliosis, widely spaced teeth, protruding tongue, and a small flat head. Angelman syndrome is often misdiagnosed by virtue of sharing several characteristics with other disorders. These include cerebral palsy, Prader-Willi syndrome, autism, Mowat-Wilson syndrome, Christensen syndrome, Pitt-Hopkins syndrome, and Phelan-McDermott. Genetic testing can be harnessed to mitigate this issue by investigating changes in the UBE3A gene. These tests aim to determine whether chromosomes are missing or mutated, or if genetic chromosomal defects have been passed on. Electroencephalogram and polysomnography tests may be administered to diagnose or verify the extent of related complications such as disordered sleeping. Angelman syndrome is a lifelong condition, but it does affect life expectancy. Children affected by this condition require constant care and will be unable to live independently as adults. While there is currently no cure for Angelman syndrome, early intervention can help alleviate symptoms and provide access to helpful tools and services. Physical therapy, which can improve posture, mobility, and balance. Behavioral therapy, to manage unsolicited behavior. Communication aids and speech therapy can help people with Angelman syndrome learn and interact better via sign language, gesturing, and technology. Anticonvulsant medication for seizure management. The majority of people with Angelman syndrome experience seizures. For these individuals, epilepsy commonly presents itself in the form of atypical absence, generalized tonic-clonic, atonic, or myoclonic seizures, which can be hard to manage. There is little definite information on the pathogenesis of epilepsy in Angelman syndrome. However, researchers have hypothesized that GABA receptors impaired by UBE3A deletion might be responsible for abnormal neuroactivity observed in AS patients. Sleep disturbances, a common feature of Angelman syndrome, are also linked to epilepsy. In a study by Khanna and colleagues, unhygienic sleep behaviors were associated with the presence of multiple seizure types. However, it remains unclear whether poor sleep patterns exacerbate epilepsy or if epilepsy leads to poor sleep hygiene. In terms of medical care, research suggests that low glycemic index treatment, a dietary therapy used to control epilepsy, could potentially be implemented as a treatment option for AS-related seizures. Other studies suggest that lamotrigine therapy should also be considered for treating AS-related refractory seizures due to the drug's inverse pharmacodynamic effect. In conclusion, Angelman syndrome is a rare neurodevelopmental condition that severely affects people's behavior, communication skills, and motor functioning. Nearly all individuals with this disorder experience seizures. Fortunately, these can generally be managed with the help of anti-epileptic medication. To learn more about Angelman syndrome, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos and subscribe today. You have the power to defeat epilepsy.